I think birth planning is really underutilized probably for two reasons. One is what we traditionally think of as access, right? This is something that is offered in person for some OBGYN practices or some regions, but it's not always available. And so folks sometimes, if they don't have access to it in person, they just won't do it. I think another reason is something we think about as access, but in a secondary way. And that's really around things like, is the in-person offering actually going to meet the needs of whoever's doing it? Are they going to be able to find a provider or someone who's providing that service who, matches what they want to engage with when it comes to lived experience? Or is it 3 hours long in the middle of the workday and, that's not something that they can accommodate in their schedule? So it's still an access concern, but more of a sort of convenience and matching one that can be just as impactful as actual limitations in physical access as well. Birth planning appointments have sort of long been established as something that can impact outcomes like C-section, for example, where self-advocacy or shared decision-making with in-person providers is really impactful with regards to, maybe there's a stalled labor, there's a push towards C-section, and maybe that's something that the patient can actually advocate for themselves and say, if this is not an emergent situation, I want to wait a little while. I think where this is new research and where our team needs to look into it a little bit further and understand it better is it's showing associations also with outcomes that are not traditionally influenced by some of these shared decision-making metrics, like NICU admission, preterm birth, et cetera. So we're really in the midst of understanding why that is. The study controlled for a lot of the factors around predicting preterm birth and NICU admission in the first place. But there's still some possibility that people who are having these birth planning appointments versus those who don't have inherent characteristics that we're not controlling for or are utilizing our care management services in differential ways that are going beyond just that birth planning appointment. So we know that this is something that can impact some outcomes, and we're sort of exploring the possibility of this as a mechanism to impact a lot of other outcomes as well. There were 3 outcomes in our poster that the team looked at. One was kind of a mechanistic, leading indicator, which is that shared decision-making metric. So this was a statistically significant finding and really showed that people who were doing those birth planning appointments versus those who weren't with the same clinical characteristics showed almost 4x increased likelihood of having shared decision-making with their in-person provider. They also, in a statistically significant way, showed about a 60% reduction in NICU admission. That's just a binary NICU admission metric where we look at people whose babies were or were not in the NICU. We're not looking at severity or any of that. And the third interesting one was it was non-significant at the end of the day, but a trending result towards reduction in preterm birth as well. So really interesting. We're not sure of the causal mechanisms yet, but really, really impactful. I think there are a lot of different therapeutic areas and areas of medicine in general where there has been a reduction in adoption of things like virtual care. But what we've really found is in the obstetric world, we see people tending to prefer virtual appointments wherever they can over in-person ones, both for reasons like convenience, but also because it allows them to self-select for a provider and have sort of a much wider range of potential experiences that they can tailor and custom to what they want. So we haven't really seen an issue with uptake. It's usually awareness, as you said, where people aren't aware that they have a specific benefit or aren't sure where to go to get those sorts of resources outside of what their OB/GYN is giving them as options in the